In the last few years, I have seen the phrase omega-3 everywhere. People say it helps lower fat in the blood and improve sleep. You hear it on television commercials, on social media, and even in health talks that many of you attend. But I am sure that very few of us truly understand how strong the effects of omega-3 really are and how it actually supports your body. The most important thing is that if you use it the wrong way, it can lead to unwanted side effects. Today I want to sit down with you and help you find clear answers about how omega-3 can support your health and why it matters for you. Hello, this is Senior Healing Hub. When you and I get older, our health becomes the most valuable treasure we have. We protect it, we take care of it, and we do our best to keep it steady. Two of the most common problems that many older adults face are trouble sleeping and high fat in the blood. Part of this comes from daily habits or eating patterns that may not be the best for the body. And like I often say in many of my previous videos, our natural reaction is to look for something safe and effective that helps us control these problems. We want solutions that keep our bodies strong, keep our minds calm, and help us sleep well at night, so we can fully enjoy peaceful and happy moments with our families and with our grandchildren. There's good news. A certain type of omega-3 has been studied by many scientists, and these studies show that it can be a wonderful companion for you. It can help you manage fat in the blood and help you sleep with better quality. But before you decide to take omega-3, you and I need to understand it clearly, so we have the right expectations. Many people call omega-3 liquid gold. During the time I have spent talking with many older adults, I noticed that a lot of you have heard of omega-3, but still do not fully understand what it is. In reality, omega-3 is not just fish oil like many people think. If you want omega-3 to work the right way for lowering fat in the blood and improving sleep, then you need to know what omega-3 really is and why your body needs it. Omega-3 is a type of fatty acid. It plays an essential role in your body and has many benefits for your health. Because your body cannot make omega-3 on its own, you must get it through your daily food choices. There are three main fatty acids inside omega-3. They are ALA, DHA, and EPA. ALA is found mostly in plant food, while DHA and EPA are found in food from animals and sea plants. I want to stress something very important. Out of the three fatty acids, the two that support your body best, especially for lowering fat in the blood, are EPA and DHA. These two are especially helpful for older adults. There are many different omega-3 products, but the pair EPA and DHA work extremely well together. Many scientific studies show that whenever EPA gives strong results, DHA is always present and playing a role as well. Both of these fatty acids are found in large amounts in cold water fish. You can find them in salmon, tuna, herring, whitefish, cod, and many other kinds of fish. These fatty acids are especially powerful for people who have high fat in the blood. Omega-3 shows very strong support in lowering fat in the blood and helping clean your blood vessels. It can also help protect you from dangerous heart problems. Scientists have also found that omega-3 is important for sleep. When your body does not have enough of this fatty acid, you may have trouble sleeping again and again. When your body cannot get the amount of DHA it needs, the hormone called melatonin becomes lower. This hormone helps you fall asleep and stay asleep through the night. Many people who struggle with sleep are people who do not have enough DHA. This is why adding these healthy fatty acids to your daily routine is very important. So, what exactly does omega-3 do to help lower fat in the blood and support better sleep? Let you and I explore this together right now. If you have high fat in the blood, there are four main benefits of omega-3 that you should understand. The first benefit is that it works directly in your liver. It helps your liver lower the amount of triglyceride it produces. Triglyceride is a harmful type of fat. DHA and EPA can lower the production of triglyceride by blocking an enzyme that your liver needs to make this fat. At the same time, they help your liver burn more fatty acids for energy. This means your body uses fat for energy instead of turning it into triglyceride. Research shows that when people take from 2 to 4 grams of EPA and DHA each day, the level of triglyceride in the body can drop from 25% to 45%. The second benefit is the support omega-3 provides for your blood vessels. It helps stabilize the plaque that has already formed in your arteries. It does not remove the plaque completely. Instead, it makes the plaque stronger and less likely to break. When plaque breaks, it can cause a heart attack or a stroke. Omega-3 also helps reduce the movement of inflammatory cells and fat into the artery walls. This slows down the growth of new plaque. The third benefit is also very important. Omega-3 helps reduce inflammation and lowers the risk of blood clots. It competes with omega-6 fatty acids. Omega-3 produces substances that reduce inflammation. Omega-6 produces substances that increase inflammation. When inflammation is present in the blood vessels for a long time, it raises the risk of heart problems. Omega-3 also helps prevent blood platelets from sticking together. When platelets stick together, they can form dangerous blood clots. Omega-3 helps lower this risk. The fourth and final benefit is that omega-3 helps steady your heart rhythm and your blood pressure. DHA can support the cells in your heart and help prevent irregular heartbeat. It can lower the risk of a very dangerous type of irregular rhythm that may cause sudden death. Omega-3 can also lower blood pressure in people who have high blood pressure. It does this by improving the lining of the blood vessels and helping your body make more nitric oxide. This natural substance helps relax and open your blood vessels. Now let us talk about people who have trouble sleeping or who do not sleep deeply. What can omega-3 do to support better sleep? First, omega-3 helps your body produce the hormone called melatonin. You know melatonin is a hormone released by the pineal gland at night. It helps your body know that it is time to go to sleep. This hormone regulates your sleep and wake cycle. DHA and omega-3 takes part in making melatonin. It does this by helping control the enzymes in the pineal gland. When your DHA level is low, this process can be disrupted. This can make it hard to fall asleep, make your sleep light, or cause you to wake up in the middle of the night. The second way omega-3 helps with sleep is by balancing serotonin. Serotonin is a chemical in the brain that controls your mood and helps you fall asleep more easily. Many people call serotonin the happiness hormone. Few people know that serotonin is also a building block for melatonin. During the day it is serotonin, but in the evening it slowly changes into melatonin. This process helps you go to sleep naturally. EPA and omega-3 helps regulate serotonin in the brain. It keeps your mood stable and relaxed. This makes it easier for you to fall asleep. This is very important for people who have trouble sleeping because of stress and anxiety. This type of sleep problem is caused by your mental state. The third effect of omega-3 on sleep is that it improves nervous system relaxation. This helps you fall into deeper sleep more easily. Beyond its chemical effects, omega-3 also affects the electrical activity in your brain. It lowers beta waves and increases alpha waves. Beta waves are related to stress. Alpha waves are related to relaxation. When people take omega-3 regularly, they feel calmer. Their sleep becomes deeper, and they are less irritable. These are some of the wonderful benefits of omega-3. It directly helps with both high blood fat and trouble sleeping. However, to get the full benefits, it is very important to take omega-3 in the right way. If you take the wrong dose or the wrong type of omega-3, it may not improve your health. In some cases, it could even make your health worse. In the next section, we will look closely at how to take omega-3 safely and effectively, especially for older adults. The good news is that taking omega-3 is not complicated. There are simple ways that you may already know, but sometimes we do not pay enough attention. Some people get omega-3 from their daily food, while others only trust omega-3 supplements in capsules. Not every method works the same. This is especially true for people who have problems with blood fat, heart health, or sleep. First, I want to emphasize the importance of our daily diet. Omega-3 is not something rare or difficult to find. If we know how to choose the right foods, getting omega-3 through our daily meals is very safe and easy. It can also be very effective. Taking omega-3 in the morning helps your body absorb it better. This can support lowering blood fat and improving heart health. That is why I want to introduce to you some foods that are rich in omega-3 and easy to include in your breakfast. The first group is cold water fatty fish. These are the best sources of EPA and DHA. You should try to eat at least 2 meals of fatty fish each week. Examples include salmon, anchovies, sardines, mackerel, and even small fish like smelt. All of these fish give us a high amount of EPA and DHA. You can make simple dishes like steamed fish with soy sauce or braised fish with galangal. Remember to use very little salt. At your age, it is better to eat lightly seasoned food because salty food is not good for your health. The second type of food is nuts. Nuts are rich in ALA, a plant-based form of omega-3. Examples include flax seeds, chia seeds, and walnuts. Our body can convert ALA into EPA and DHA, but the conversion rate is low. Even so, ALA is still very good for heart health. You can add these seeds to oatmeal or yogurt, and they will give you a healthy boost. The third food that is rich in omega-3 and easy to use every day is eggs. Omega-3 enriched eggs are an excellent choice. You can include them in many of your daily meals. Adding omega-3 to meals that already have healthy fats helps your body absorb it better. Research shows that taking omega-3 in the morning with food that contains healthy fats can increase absorption by up to 40% compared to taking it on an empty stomach. This is a safe and effective way to get omega-3 from your diet. The second way to get omega-3 effectively is through capsules or pills. Many older adults trust and use these supplements. If your diet does not provide enough omega-3, capsules can help. They are a simple and convenient way for people to get the nutrients they need. Sometimes people have misunderstandings or do not fully understand how to choose omega-3 products. Before you buy, you should carefully check the product. Look at how much omega-3 contains, how to take it, and whether it suits your health needs. Are you trying to lower blood fat? Are you managing diabetes? Do you have trouble sleeping? Think about what benefit you want from omega-3, and then decide which product to buy and how to use it. It is very important that you buy omega-3 products with advice from doctors or professional pharmacists. This way, you will understand the product and how it can help your health. It is not enough to see a bottle of omega-3 and hear someone say that it is imported and very good, or that it is on sale and costs much less than usual. These things alone will not guarantee the results you want for your health. You should also pay attention to the dosage. Taking more than necessary can be dangerous. For older adults, the right amount is important. Taking 2 or 3 capsules, or even more, without guidance can create health risks. There are products that contain high levels of EPA and DHA. Some also include coenzyme Q10, which helps support the arteries, strengthens the blood vessel walls, and reduces the risk of blood clots and strokes. These products are very suitable for people with high blood fat, sleep problems, or those who want to support their health as they age. The key is to take the proper dose. Do not assume that taking more will give better results. If you are dealing with high blood fat, sleep problems, or simply want to improve your health, it is best to consult a professional first. Each person is different, so what works for one person may not be suitable for another. During my experience advising many people, I have noticed that many older adults make serious mistakes that reduce the effectiveness of omega-3. In some cases, it can even harm their health. I want to share the 3 most common mistakes so you can avoid them. The first and most common misunderstanding is the belief that taking more omega-3 will lower blood fat faster. This is very dangerous. Many people think that because omega-3 is good for heart health and blood fat, taking more will give faster results. The truth is, taking too much does not improve blood fat and can even negatively affect your health. It can make sleep problems worse. When the body absorbs too much omega-3, especially from capsules, it can thin the blood and make it harder for platelets to clot. This can lead to nosebleeds, bruising, or even gastrointestinal bleeding in older adults. Taking too much over a long period can also cause digestive problems, slightly increase blood sugar, and lower blood pressure too much in people with heart conditions. Omega-3 is very good for your health, but it is only effective when used at the right dose and in the correct way. If you do not have a clear recommendation from a doctor or pharmacist, you should take about 1,000 milligrams per day, including both EPA and DHA. For people who are treating high blood fat, the The maximum recommended dose is about 2 to 4 grams per day, and you should follow specific guidance. I want to emphasize again, do not think that taking more will give faster results. Take the right amount, take it regularly, and be patient. Your body will gradually respond, absorb it properly, and you will see the benefits in lowering blood fat. This is the safest way for older adults. The second common misunderstanding is that taking omega-3, 6, and 9 together is the best. While it is true that the body needs omega-3, 6, and 9, most people already consume too much omega-6 through everyday cooking oils, such as soybean oil, rice bran oil, and other vegetable oils. Excess omega-6 can cause inflammation. Omega-9 is naturally produced by the body, so there is no need to supplement it. What most older adults actually need is omega-3, especially EPA and DHA. Taking all three together is unnecessary. It can even create an imbalance and worsen blood fat problems. Older adults, particularly those with high blood fat, should focus on supplementing omega-3 only. The third common mistake is thinking that omega-3 can be taken anytime, or on an empty stomach to absorb it better. As I mentioned earlier, omega-3 is a type of fat. It requires other dietary fats to be absorbed properly. If you take omega-3 on an empty stomach, it passes through your intestines without other fats to dissolve it. This greatly reduces absorption, and much of it is wasted. The best time to take omega-3 is during a meal or immediately after eating. Meals naturally contain fats, which help dissolve omega-3 and allow it to be absorbed effectively. Some people may forget to take it during meals, but if you take it right after eating, your body will absorb it much better. These three misunderstandings may seem small, but they are the reasons why many people do not achieve the full benefits of omega-3. In some cases, they can even cause additional health problems related to digestion, blood pressure, or overall effectiveness. Now I want to share some very important notes about taking omega-3 so that you can avoid risks and get the best results. As I mentioned earlier, there are two ways to supplement omega-3. The first way is through everyday foods. Fatty fish, dark green leafy vegetables, certain seeds, and oils from canola or other healthy sources can provide omega-3 naturally. The second way is through supplements, such as omega-3 capsules or soft gels. These can help if your daily diet does not provide enough omega-3. For older adults who do not have heart problems, it is recommended to eat fatty fish at least 2 times per week to maintain an adequate level of omega-3. For those with high blood fat, heart problems, or high blood pressure, the safe dosage has already been explained earlier. You can get omega-3 from foods, but I also recommend using supplements. Supplements provide a stable amount of omega-3, especially EPA. Timing is very important too. Omega-3 is a fat, so it should be taken during or immediately after a meal to maximize absorption. Meals that contain healthy fats, such as oils, fatty fish, or avocado, will help your body absorb omega-3 more effectively. For those who have trouble sleeping, experience restless nights, or wake up frequently, taking omega-3 right after dinner can help relax the body and support melatonin production, improving sleep quality. However, I must remind you again that taking too much or using it incorrectly can cause unwanted side effects. These may include bloating, nausea, diarrhea, itching, low blood pressure, or nosebleeds. Older adults who have digestive problems, take blood thinners, blood pressure medication, or are allergic to seafood should be especially cautious. In these cases, algae-based omega-3 supplements may be safer. During the process of using omega-3, especially from supplements, if you notice any unusual reactions, stop using it immediately. Consult a doctor, pharmacist, or healthcare professional to get guidance that fits your health needs. When used at the right dose, in the right way, and at the right time, omega-3 can become an excellent companion to help you improve blood fat, support heart health, and significantly improve your sleep. In my experience advising many older adults, I have seen many challenges related to blood fat, diabetes, joint or stomach problems, and sleep issues. These concerns make the proper use of omega-3 especially important. At the end of this video, I would like to take a few minutes to answer some common questions that many of you have. This will help everyone understand clearly before deciding to use omega-3 supplements. The first question comes from someone who has stomach problems, acid reflux, or finds that fish oil makes them burp with a strong, unpleasant taste. This is actually a very common situation, and many people experience it. Not just you. When this happens, it can make taking the supplement uncomfortable. I will share 3 simple tips to help reduce these issues. First, take your omega-3 during your meal. Instead of waiting until after you finish eating, take it while you are eating. This way, the capsule will mix with the food and be digested together, which can greatly reduce the fishy taste and the burping. Second, store your fish oil capsules in the refrigerator. Cold capsules move through the stomach more slowly, and their outer shell becomes slightly firmer. This allows them to pass through the stomach before dissolving, which can significantly reduce the fishy burp. Third, split the daily dose into smaller portions. For example, if you normally take 2 capsules a day, take 1 in the morning and 1 at lunch, or 1 in the morning and 1 in the evening. This prevents the stomach from handling too much oil at once, reducing the risk of burping and discomfort. The second common question is about how long to take omega-3 and whether long-term use can harm the liver or kidneys. Many of you are concerned about this. You can rest assured. Omega-3 is a healthy fat, similar to what you get from everyday foods. It is not a specific medication or a risky supplement. When taken at a safe dosage of 1 to 2 grams per day, it is completely safe for long-term use. It does not harm the liver or kidneys. To optimize results, you can take omega-3 in cycles. For example, take it for 3 to 6 months, then take a break for 1 month. This break gives your body time to rest and allows you to check your health indicators. For example, you can test your blood fat levels. If your blood fat is still high, it may mean that your diet is not yet adequate, such as not eating at least 2 meals of fatty fish per week, or your omega-3 dosage is not sufficient. In that case, you can start another cycle and adjust the dosage according to the guidance of your doctor or pharmacist. The third question is from someone who follows a strict vegetarian diet and does not eat fish. You asked where to get omega-3 to help lower blood fat. This is a very good question because I see that many older adults choose vegetarian diets. When we follow a vegetarian diet, we usually eat nuts such as walnuts, flax seeds, and chia seeds. These foods contain omega-3, but it is in the form of ALA. For older adults, the body's ability to convert ALA into EPA and DHA is very limited. Sometimes it is only 1 to 5%. This means that if you only eat these nuts, you will not get enough EPA and DHA. The solution for vegetarians is to use omega-3 derived from algae. You can think of it this way. Fish are rich in EPA and DHA because they eat algae. Algae is the original source of EPA and DHA. Scientists have extracted EPA and DHA directly from algae, which makes it the only plant-based source that provides EPA and DHA directly. This is completely suitable for vegetarians and is just as effective as fish oil. When buying these products, make sure to read the label and check for the words EPA and DHA to see how much is included. The fourth question is about taking omega-3 while already using prescription medicine for blood fat. Some people ask if they can stop taking their prescribed medicine and use omega-3 instead. This is a very important question, and it helps many older adults avoid serious mistakes. I want to emphasize that you should never stop taking any medicine prescribed by your doctor. These medicines are necessary to lower specific blood fat levels, especially LDL cholesterol. Omega-3 is considered a supportive supplement. It helps reduce triglycerides and supports heart health, but it cannot replace prescription medication. You can use both together safely. Omega-3 can complement your medicine and improve its effects. However, as I mentioned earlier, you must inform your doctor that you are taking omega-3 so they can monitor your condition. This is especially important if you are taking blood thinners. Always take your prescribed medicine and consult your doctor before adding omega-3 to your routine. Today's video has been quite long, but together we have explored omega-3 in detail. We discussed what omega-3 is, how to supplement it effectively, the 3 common mistakes to avoid, and useful tips for using it safely. I hope that through this video and my guidance, all of you will better understand how to take care of your health and the health of your loved ones safely and effectively. If you found this video helpful, please click the like button and share it with your family and friends so they can also learn how to supplement omega-3 effectively and protect their health. Thank you to all of you for following along and listening carefully. I wish you all good health, happiness, and the knowledge to take care of yourself and your family. Goodbye for now, and I look forward to seeing you all again.